So I have a notoriously low vitamin D, and this is the brand that I found that worked for me. I was living at about 40 for my serum D levels. I get my D checked every 6 months, and I was taking really great pills. I was taking great supplements, and I could not get my D to come up. So then I started taking 10,000 D, a pill. It still didn't come up. And so this liquid tincture is organic, 10,000 IU of D3 with 120 micrograms of K2. D3 needs to be taken with K2 because they are friends and they help with the absorption. Now, my D levels finally started to come up when I started taking this daily. I'm about to test again and see if I am in the 50s. If you don't know, you can check your serum D levels. You can actually have blood work done to check your serum D every 6 months. You don't technically even need a doctor's prescription because most of the time your insurance doesn't even cover vitamin D in your blood work, and that's why sometimes doctors don't order it. So I ask for it, and if I'm not seeing my doctor and I need to check it, but my levels are finally coming up. If you have levels in your 60s, like your serum D is 60 and 70, if your serum D is 80, you are amazing. You're doing great. Keep doing what you're doing. But if you're like me, living in the 40s, living in the 50s with your serum D levels, not enough. You need to ramp that up. Now, technically speaking, every biped needs to take vitamin D in the US. I don't care if you're outside all the time. You probably need D. Now, I am taking 10,000, which is a high dose. But guess what? The way I process D is apparently succola, and this is just me. A lot of my patients don't have to take 10,000 very long, but as for me and my deficiency, I do. Now, as a physical therapist, I talk about D3 with my patients because D3 is not a vitamin, it is a hormone. Very important for breast health, very important for pelvic floor health. So if you have pelvic floor pain, you could take some D3. If you are worried about breast cancer, take some D3. If you are perimenopause and menopause and you actually are worried about your bone health, take some D3. The way you think about calcium for bone health is the way you should think about D3 and K2. Calcium is great, but it's not the whole story. And the Milk Council made you care about this whole calcium bit. I mean, you know what I mean. Like the drinking the cup of milk and caring about your calcium and healthy bones, the reason that's in your brain is the Milk Council. So calcium is important. 300 could be from your diet, 300 could be from food, but it is kind of like you're getting your calcium. Odds are good, you are fine, but you're not getting this. And if you want to know what your level is, go to your doctor or go to CompuNet. Go to where your blood work can be drawn and just ask for yourself. You don't even need a script. One of the best things that you can do for yourself is to care about your D levels. I promise you won't regret it. Also, did you know if you have widespread joint pain and you have low D, that could be part of it? Yes, your low D can give you crappy bones and joint pain.